The clinical examination of the abdominal cavity in cattle. So when viewing cattle from behind, we divide them into four quadrants: the left dorsal quadrant, the right dorsal quadrant, the right ventral quadrant, and the left ventral quadrant. In the case of ruminal bloat, it'll be more rounded in the left dorsal quadrant. This is where the rumen is located. And in the case of Hoflund syndrome, it'll be increased in the left dorsal quadrant where the rumen is, but also in the right ventral quadrant where the abomasum is. And in the case of pneumoperitoneum, it'll be increased in the left dorsal quadrant and the right dorsal quadrant. Auscultation, there should be 5 to 12 ruminations for every 5 minutes. If there's a grunting sound, that means the cow is in pain. There are 4 different pain probes we can use. We can use the pinch test or the back grip, so you can pinch when you auscultate and you'll hear a grunt, or grip the back. Or you can use a pole test, such as underneath, lift up a pole, or hit the cow with a rubber hammer. Or you can also do the knee elbow test. Left displaced abomasum, it's on the left side, and we can find it at intercostal space 9 and 13. In the case of ruminal collapse, we'll find it on the left side, so check the left flank, and it's sometimes underneath the spine. Right displaced abomasum, it's on the right side, so check intercostal space 9 and 13. The animal will be in bad condition and be in shock. In the case of cecum distension, it's on the right side, so on the right upper flank, and it'll have a sausage-like aspect. And for the proximal colon distension, it's on the right side, on the right flank, and it's usually benign. And for the case of duodenum distension, it's on the right side, in the intercostal space 9 to 13, same as the abomasum, and it's straight in the midline. It's usually a serious general condition. And for pneumorectum, it's on the right side, on the right flank, and it's usually benign. When inspecting the musculoskeletal system, inspect it, palpate it, check the lymph nodes such as the submandibular, the parotid, the retropharyngeal, the prescapular, as well as the supramammary lymph node. And for the udder, inspect and palpate.